Dr. Tan Wu Meng.
Mr. Speaker, sir, may I have your permission to answer questions 20 and 21 on today's order paper?
Go ahead.
Thank you, sir. My response will also cover matters raised in the written question 4825 by Dr. Tan Wu Meng. Sir, according to the Singapore Mental Health Survey 2016, 2.8% of Singapore residents aged 18 to 34 years had bipolar disorder. The proportion with active symptoms was lower at 2.1%. Members raised concerns about individuals being denied health insurance coverage due to their mental health conditions. This is a valid concern and should be considered within the larger context of our S+3M healthcare safety net system. All Singaporeans are eligible for healthcare subsidies of up to 80% in public healthcare institutions. All Singaporeans and permanent residents are also covered under MediShield Life, regardless of pre-existing conditions, including mental health conditions. MediShield Life is sized to cover 9 in 10 bills in the subsidized wards of public healthcare institutions. Beyond subsidies and MediShield Life, individuals can also buy private integrated shield plans and other insurance plans. In making underwriting decisions, insurers are fully expected by MOH and the Monetary Authority of Singapore, MAS, to deal fairly with their customers. For example, insurers should not indiscriminately reject an application solely on the basis of the declared personal information such as occupation, income, disability, or medical condition, including mental health conditions. Insurers should carry out an objective assessment of every application based on reliable information or data relevant to the risks being insured. Where an application is rejected or approved with higher premiums or additional conditions, insurers should properly explain to the customer the basis for the underwriting decision. MAS will take action against insurers whose practices are in breach of MAS's regulation or guidance. Individuals who have concerns over their insurer's underwriting decision can make an appeal through their insurer's feedback channel or through MAS.
Dr. Tan, please keep your SQ short. You want to allow Ms. He to also ask her SQ.
Thank you, Mr. Speaker. I thank the Minister for his answer. Can I ask the Minister if he'll consider one suggestion? Would MOH look into setting up a website portal so that members of the public can provide authenticated experiences of their dealings with insurance companies, including when the company is unreasonable in refusing to provide insurance coverage, such as in the case of the member of the public, Tan Hui In, who in the Straits Times Forum in July mentioned how their daughter had bipolar disorder but got turned away by 2 large insurance companies. Mr. Speaker, can I ask Minister to consider this? Because such a platform will help the public see better which firms are kind or which firms might be considered one kind. Thank you.
SMS Janil.
So I thank Dr. Tan for his suggestions. I think firstly, a website or a social media page portal doesn't need MOH to set that up. I mean, these are experiences that the public can indeed share. But I think the larger point is perhaps should we take into account complaints or concerns expressed by members of the public in how they have been dealt with by their insurance company and use that some way to inform the public better. It's a good suggestion. I'll take it back to my colleagues in MOH and we'll study to see how this can be used to improve conditions for all the insured.
Ms. He.
Thank you, Mr. Speaker. Thank you, SMS, for your reply earlier. I have 2 SQs. The first being, I noticed that SMS quoted data from the 2016 mental health survey that was conducted. I'm just wondering whether a more up-to-date, survey is in the works, given that, with increased awareness and after COVID-19, we could actually see a difference in the number of individuals who are diagnosed with mental health conditions and illnesses. The second point is, does the ministry consider, these issues about, ostensible denial of insurance coverage? Does the minister consider this to be a problem, or would the ministry, or is the ministry working with MAS at the moment to study if this, whether this is an issue, and how many individuals this might actually be affecting, and whether or not further remedial action needs to be taken to make sure that insurers are not discriminating against these individuals. Thank you.
SMS Janil.
Thank you, sir. I thank Ms. He for the questions. The short answer to both questions is yes. There will be further surveys and studies conducted and released, and MOH and MAS do continue to work together to see how we can appropriately regulate and guide the insurance industry to be able to provide these products in order to appropriately protect the public.